Talking about a condition called jumper's knee. Hello, I'm Dr. Mohit Arora, consultant orthopedic surgeon currently practicing in Gurgaon. Today in this video, I'll be talking about a condition called jumper's knee, which is very common, especially in young adults who are involved in athletic activities. So jumper's knee diagnosis is patellar tendinitis. So इसमें क्या होता है कि the patient usually presents to us with the pain at the front of the knee. So basically जहाँ पे patellar tendon insert करता है at the inferior pole of the patella, there is always a inflammation in this condition because of repetitive usage during athletic activity. And कभी-कभी इसमें X-rays में there is a tractional spur or anthesiophyte which we call can also be found out on radiological examination. Now clinically there is a definite tenderness at the inferior pole of patella, which can be elicited or exaggerated by active extension of the knee against resistance. So management wise, it's very simple: rice, rest, ice compression, limb elevation, and a crepe bandage application. However, if the symptoms does not go, we ask the person to modify the activities, and sometimes they have to take a break from that particular sports which they are involved in. Then there is another thing called PRP injections, which can be given in this condition if the patient is not responding to standard conservative treatment, which usually accelerates the healing of the patellar tendon involved in this condition and leads to rapid healing and ultimately helping them go back to sports. Thank you.